Thank you. Thank you, Dr. Raja, for this wonderful presentation of the seminar series. And it's now my pleasure to introduce our two speakers for today. I will start with Gloria Aidoo-Frimpong. She is a fourth year PhD student, a PhD candidate, and a Schomburg Fellow in the Department of Community Health and Health Behavior at the University at Buffalo. She has a master's degree in international studies and an MPH from Ohio University. Ms. Aidoo-Frimpong's research focuses on HIV and AIDS, particularly pre-exposure prophylaxis, global health, and sexual and reproductive health, with a critical focus on African immigrants and refugees. She is joined today by Dr. Kafuli Agbemenu, who is an alumna of UB School of Nursing, where she got her bachelor's degree. She also went on to earn an MPH with a focus on behavioral and community health and global health, and she holds an MS and PhD in nursing from the University of Pittsburgh. Her areas of research interest include adolescent and reproductive health and women's health in the African immigrant population. She teaches in this School of Nursing on population health and ethics for healthcare professionals. So it's our pleasure to welcome both of our guests today. And before they give their presentation, I want you to be aware that you should feel free during the presentation to type in your questions into the chat or into the Q&A. We will be monitoring them, and then we will pose these questions to our speakers when they finish their presentation. We will then open the forum for discussion, where we hope to have a lively conversation between the speakers and our guest attendees. So with that, welcome to Gloria and Kafuli, and please go ahead.
Thank you so much for that introduction. Thank you all for being here with us today. So Gloria and I have been working together for about 4 years now, I guess, fourth year. So we've been working together for about 4 years now. And when we were thinking about this presentation, we wanted to have a presentation that was very practical, if I may say. So in today's presentation, we are going to walk you through maybe some of the differences between an immigrant population and a refugee population. And then we're going to segue into our research topics. Our research topics are related, however, we do have some differences as well. I primarily work with the refugee population, African refugees, and Gloria works with African immigrants. So we're going to give you a little bit of a snapshot of how research looks like in our populations, the different challenges, successes we have. Because this is supposed to be student driven, I'm going to let Gloria do most of the talking, and then I'll join in a little later on. So Gloria, please.
Yeah, thank you so much, Dr. Agbemenu, and welcome everyone to our presentation. So first off, we want to look at who is an immigrant and who is a refugee, just because most of the times these terms are used interchangeably. And so first you want to look at a refugee. Keeping in mind that when we say someone is a refugee, that means that that person is fleeing, that person is forced to leave their home country. So it may be because of persecution, it may be because of war, so many other reasons that would let a person flee. And so usually because they are forced to leave, sometimes it's a very sudden transition. So they don't have time to actually put their businesses together, to plan their life the way they want it. It's just in a blink of an eye, you have to leave, which means that their education is also getting interrupted or postponed for the time being. There is a profound sense of loss and trauma that comes with it, because in a war environment, in an environment in which you are being persecuted, you don't really, just because you leave the family, the situations you go through trying to hide, trying to make your way to a safe passage to a very safe country actually magnifies this loss. That sudden transition sometimes creates difficulties and confusions as well. Returning home is usually not an option because remember, you have been forced to flee. So you don't get up and say, I'm going back to go visit. And this might also magnify that sense of loss and trauma. Usually children and families may be separated during this transition. And basic requirements of food, housing, and medical care may be urgently needed when they come to their new host country, because usually sometimes the transition is rough and they don't usually go from one country to the next. For instance, for refugees that may be resettled in the US, not everyone just came from their home country into the US. Sometimes there is transitions to different countries before they come, and they are housed in refugee camps. Sometimes the situations in refugee camps are not the best. And so all this contributes. For immigrants, usually because they have, the key word here is choice. As a decision, they decide to leave. So there's that choice. So they get the chance to actually plan their life, take care of business back home before they leave. Their education usually continues uninterrupted because sometimes they may decide, I am finishing my first year in college, I am finishing high school before they move. And so that transition is not cut off. That sense of loss and trauma is not necessarily present. And even when present, it's experienced on a different continuum compared to a refugee. They also sometimes have time to prepare for that transition because then they would call friends, they'll call family, they have time to research the country they are going into. Returning home is also a personal choice because they are not fleeing. They decided to leave for more educational opportunities to better their lives, and so they can return back home. And sometimes they migrate with their families, or the families have an option to join them. And so the family unit is still often intact. Arrangements, like I said, have been made because they've had time to plan this move. These two distinct groups notwithstanding, there's some intersections, right? So both an immigrant and a refugee, they have left behind friends, they've left behind family, they've left behind things that are familiar to them to come into a new environment. And so they would be coping with different culture, a different weather, different language. And so within these two, these are some of the shared similarities. Also, the desire to an opportunity to pursue their goals doesn't end, whether as a refugee or as an immigrant. That desire, just because you left your country, whether forced or through a personal choice, does not mean that your desire just ends, right? And then also they may require linguistic and academic support. Usually, especially with refugees, it becomes very obvious that, oh, we may need to support. And sometimes we forget that immigrants may also need that kind of support because it is a different educational system. And so both group of people will need that required linguistics and academic support. And they may also take on roles that are different, especially in the family, from what they are traditionally used to in their homes. Within the American system, you would have, mother, father working, sometimes the children, compared to like being back home where it would have just been the father. So just different systems in that sense. So broadly, when we look at the data on African immigrants in the US, we know that there are slightly more than 2 million immigrants from sub-Saharan Africa that have lived in the US since 2018. Now, whilst this population remains small, it represents about 4.5% of the entire country's 44.7 million immigrants here. But the African immigrant population is one that is really rapidly expanding. So there's just a diversity for this population. And usually when data is collected, the term African immigrants also captures the refugees as well. And the top 5 countries remains Nigeria, Ethiopia, Egypt, Ghana, and Kenya. Now, I must mention that the African immigrant group is one that is highly educated in the US. Consistently, data shows that this group remains one of the most highly educated that come in here. But despite that, African immigrants still remain one of the least studied immigrant groups. And when I say African immigrants, I mean immigrants and refugees as well. So despite the fact that we know that there are health disparities, it still remains one of the most under-researched populations. And this is because consistently data for African immigrants are always aggregated with other Black categories in the US. So other phenotypically similar groups like African American and Caribbean immigrants in the United States. And so this aggregation usually obscure that distinction that exists between the groups. So their unique healthcare background, their cultural backgrounds, their healthcare needs are not really that apparent because of this aggregation. So now we are going to talk a bit about our research, and I'll pivot back to Dr. Agbemenu so that she will first tell us about her research.
Sure, thank you. I don't see myself in the video yet, but I hope you can all see me. So thank you. My research focuses on reproductive and sexual health. I look at several different domains of reproductive health, which has a very broad definition. If you think about the reproductive lifespan from puberty to childbirth to menopause, but I don't deal with the menopause side, we deal with reproductive health. I've done some work on reproductive health education where we looked at how African immigrant mothers provided reproductive health education to their daughters. Very important in that study was the finding that even though mothers lived in the US and the daughters most likely were born in the US, the mothers still adhered to their cultural, I would say, strongholds from country of origin. What that means is, in that study, at the very least, we saw that mothers were not really seeking out reproductive health education in the American environment. They were still adhering to what they knew from back home. And very interesting, I remember one of the mothers said, I want to tell my daughter about the myths and taboos that we had back home in the hopes that it would scare her and change her reproductive health behavior in the US. So there was that harkening back to the system back home, and we did not quite see them seeking out resources in the US. In other studies, we've looked at access to reproductive health care. That was a study out of Ohio, where we looked at the Somali population. In that study, we saw that women, first of all, were not accessing prenatal care. And we also saw that there was a delay in seeking care once they went into labor. Let me talk a little bit about access to prenatal care. When you think about the US context, US environment, there are set times at which you are supposed to go for prenatal care. I believe we have about 10 or so visits that are expected. You would start your first visit at approximately 8 weeks. Once you have that positive pregnancy test, and then on a monthly basis, and then you'd move on to a bi-weekly or a weekly basis as pregnancy continues. But then you have a population who are coming from other culture, other environment where they saw pregnancy as a very natural process. Because pregnancy was a very natural process, they did not see the need for intervention. So we saw some of participants in the study not seeking prenatal care until they were 7, 8 months pregnant because they did not see the point. This wasn't something that was practiced in their culture. We also saw that they had a fear of the US healthcare system, where they had this idea that if they seek care from the US system early, doctors would try to sway some of their reproductive health decisions in one way or another. We also saw in that study women coming, so the women went into labor, they would wait as long as possible to come to the hospital. Women mentioned that they did this because in their experience, either doctors would try to persuade them to have a C-section, which they felt was not necessary, or other US embedded, I would say, gynecological practices, laboring while laying in bed. And you've come from a culture where a laboring woman walks around. A laboring woman is able to eat. And in the US healthcare system, once labor is determined, you're most likely not able to eat because there's that anticipation that you might need surgical intervention. So you're spending, hours, days sucking on ice chips and just very exhausted. So population were aware of this and they delayed access to care. And then it's quite complicated, but on one side, there's access to care, which means just being able to having health insurance and being able to see a provider. And what we found out there too is that with the African refugee population, they were more easily able to see a healthcare provider compared to the immigrant community. And this is due to differences in health insurance. So just a little bit about that study, and then in regards to pregnancy intention and contraceptive use, we finished up a study looking at contraceptive use in the African refugee community, and noted a discrepancy between contraceptive use and we'll call it pregnancy intention. So you ask women how soon or how many years before you want to have your next child, and the women would say maybe in 2 years. Are you using any contraceptive methods, including natural family planning? No. So there was that disconnect that we saw, and we are investigating further, and we're getting ready to do another study that will be a contraceptive, a family planning intervention. So anyway, that's a little bit of my work, and back to Gloria.
Okay. And my work primarily involves HIV prevention. We've done some work among African immigrant refugee women, actually. We looked at HIV attitudes and beliefs. And with that study, we found out that whilst, attitudes were stigma was really high among our population, but then interestingly, they also had a very high screening rate. Unfortunately, we couldn't investigate if it was because they were getting screened during pregnancy or not. And so a new study may help give us much more information about that. My current study looks at pre-exposure prophylaxis among African immigrants, and I looked at it among Ghanaians. And so for that study, we found that knowledge was quite low. Not a lot of people know about pre-exposure prophylaxis. And pre-exposure prophylaxis is medication that you take before exposure to HIV so that you do not get infected, just in case you are exposed to the HIV virus. So you take it when you are uninfected, and so it prevents you from getting the disease. It's a pill that you take 1 a day. Currently, it's an oral pill. There are other methods that are in development. You have long-acting injectables. There's the patch that are all in development. But currently, what is approved is the pill. And so we noticed that with our participants, most of them were open to it, even though they don't know about it. When we mentioned it to them, described it to them, people were actually open to PrEP. They thought it was a good idea to have medication that will prevent HIV. And in terms of willingness, there were just a bit of divergent willingness, which goes to the idea of people's perception of risk. One of the studies where we looked at HIV risk and then factors that would actually help factors that would influence HIV risk among African immigrants, we found out that risk perception was very low. Most people perceived their risk to be very low. And interestingly, their risk was also not based on individual behaviors, right? Like condom use, like having sex without protection, but really it was based on geographical location. So most people perceive that because they are within the United States and there are services that exist, they are not at risk. So they may not be utilizing the service. However, the perception that there are these services that exist actually fosters that idea that I am not at risk of HIV prevention. And so these studies are ongoing, still being analyzed. I also looked at barriers and facilitators to PrEP uptake. Most of these barriers were largely sociocultural barriers in that sense. We are also looking at technology-based methods for recruitment. One of the things, and we would mention it, is the challenges in recruiting African immigrants and refugees for research. And so we have come to the place where we realize that technology, leveraging that technology that is very popular, that is what African immigrants and refugees are used to for research among the population. So currently, we have a study that we are using, WhatsApp. This is a study looking at contraception and reproductive intention among African immigrants. So all the inclusion criteria is you have to identify as an African immigrant. So it's not limited to like West Africa, East Africa, just across the continent. And we are using WhatsApp. These are some of our publications that have come out of the work that we've done. This was on the HIV attitudes and beliefs. And then this one was also looking at just a review of cultural influences on risk for HIV and some of the ways we can actually mitigate these risks among African immigrants. Next, we want to talk about the challenges with recruitment and enrollment. So one of these things, the first thing is the history of research misconduct and subject abuse in the US. And I know that For most people here, you've heard of this, several times. Now, there's a huge mistrust of academic and research institutions and investigators, and this is one of the most significant attitudinal barriers to research participation. And we do know that this etiology stems from historical events like the Tuskegee environment, that Tuskegee syphilis study. For African immigrants and refugees, upon migrating to the United States, they become aware of these historical issues that have been forced and faced by African Americans. And this issue actually may bias their perception of research on the Black populations within the United States. Within the African countries as well, there has been experiences. And so when you look at the top right corner, I don't know, it looks on the right to me, but I don't know if you see it as the right, but you can see this picture where during the COVID era, there were just resistance to the COVID-19 vaccines that actually reflects the ongoing bias, that the people are saying no to Gates poison, we don't want the gates of hell here. This sign talks about we are not guinea pigs. And so just the idea of experimentation, that mistrust in the system continues to play a role with recruiting African immigrants and refugees for research. Next is the fear of breach of confidentiality. So immigration and legal status are really essential considerations in conducting research among immigrant populations and refugee populations. So for potential participants, the revelation of their legal status is a very valid concern. And undocumented immigrants who choose to participate may fear that their status will be disclosed to authorities, which may result in detention and deportation. For refugee populations, due to trauma and experiences, especially during their transition, the issues with documentation may lead to a lot of discomfort. And so usually people may not want to do signed consent forms. These are things that are standard within academia and academic research. The IRB wants signed consent forms. They want to see that documentation. However, with a population like immigrants and refugees, it becomes quite challenging, just because where is this information going to land? Who is going to see it? And this in itself sometimes play a role to the extent that in my research, I noticed people were even unwilling to give demographic data, asking about their age, asking about income. People do not want to even give this information. And so sometimes people, when they see in your survey, usually demographic information is right up front. So sometimes people will see that information and stop taking your survey. And so it becomes a challenge. The next challenge with recruitment is non-standard approaches. So usually with research, usually you have a flyer, beautifully well-designed flyer with information, with emails, and you're asking people, oh, contact me if you're interested. With our population, you go to the population, they don't come to you. And so that is one of the things, in word of mouth is powerful. So with immigrant population and refugee population, one of the things to just keep in mind is that sometimes people are not literate in English language. So the reading and writing of the English language. Sometimes too, people may not actually be able to read or write their own language that they speak. And so they can speak it, but they cannot read or write, which means you have to be very creative in how you recruit. So sometimes you have to go to churches, right, to recruit. And it's not like you go to the church one day and you tell people I'm conducting research, nobody will mind you. You have to continuously go to church. You have to become known. And so when you launch your study and you tell people I am doing this study, then people will participate. So it takes time. And sometimes, between the time of the grants and the timing that you've put in the grant to finish the study, you have to factor all this thing in, that you have to go to church continuously before you can talk about your study, before you can start the study. Next is word of mouth. This is really powerful. Yes, you are the PI. Yes, you are the one who's saying, I want to do this research, but it depends on who is recommending you. So who is telling who in the community to take part in this study? And that is when you would be able to actually recruit. And if you have a study that people are not recommending or telling others about, your study is not going to go far. Next is the African market. Now, this remains like a common place, in addition to church, for a lot of African immigrants and refugees. It's a source of, it's a link back home. It's a place of comfort. And so people go in there to get their food. So consistently, it's not just about going in there to say, I'm going to paste a flyer to recruit. People will walk past it and not read. Usually on the African market, they advertise obituaries and community events. So nobody is going to read that. You need to have a relationship with the African market manager, the people there saying hello, Saturday, standing there, people coming in and chit-chatting, getting to know you to be able to recruit. And next is social media, leveraging the platforms they use. So WhatsApp, Facebook, Instagram, very popular among immigrants, and they all have very distinct role. But WhatsApp is unique for African immigrants because we use it for information, we use it for social support, we use it for informational purposes. I think most African immigrants in the US belong to at least 3 or 4 groups on WhatsApp that, you know, provide you with information and stuff like that. So it's very important that you understand the methods of recruitment for this group. Next is the language barriers and literacy, like I mentioned. Now, when you look at this map attempts to give you an idea of the most widely spoken languages of Africa. The colored ones show you what the colonial languages are. Now, within each country, there are like different languages, and this one says the most widely spoken. When you look within Ghana, there is like 3, the Broad Akan, Fanti, Chi, Big. When you go to Nigeria, there's Igbo, there's Yoruba, there's Pidgin, there's Hausa, different languages. And so sometimes the concepts may not translate over really well. Understanding, so what is the language I'm going to use for this research? Very important. Usually we default to English because it's easier. We tell ourselves, you know, it's cut across, and especially if you're doing research among West Africa or, you know, looking at the South, you default to English because you say, oh, you know, that is, you know, the official language. But having it as an official language doesn't mean that everybody understands. And then sometimes, to be honest, our surveys are, you know, sometimes written in academic language, right? We write it in very academic language and not in the simplified way that people are used to. And so the idea is thinking to what language am I going to use? And choosing one language means that I am favoring that language. Will it reinforce that ethnic hegemony that exists in that country? These are all important thoughts that go into it. That if I'm going to translate my survey or my, you know, interview guide into that language, what am I missing? What am I missing? So it's very important that, you know, we pay attention to, you know, the language barriers that may exist and may also end up maybe excluding others who could potentially, you know, take part in a survey as well. Now, this is one of the big parts, the heterogeneity within and between cultures. Now, this is an ethnic map of Africa by National Geographic. They try to create just the ethnicity. And so when you just look at this map, the diversity that exists within within countries and just is mind-blowing, and even within itself and between the countries is mind-blowing, right? So here, I bring it down a bit to first talk about Ghana, and then I'll let Dr. Agbemenu talk a bit about Kenya. But when you look at Ghana, there are 16 regions, and within each region has different culture and different languages. So when you say I am conducting research or I'm recruiting Ghanaians, who are you recruiting? What language? And when you are writing, if you recruited people from the Upper East region, and you are writing, would the culture of the Upper East or Upper West region be reflective of what is in the Western region? No. These are different cultures. With the way they do things, different language, different food, even though they exist with one national identity as Ghanaians. And so in your writing, when you say Ghanaian immigrants do this, are you sure Ghanaian immigrants do this, or it's a particular ethnic group? So the diversity that exists, making sure you know what language to use, making sure that there's an understanding of the culture so that you are not misrepresenting the people that you are saying that, you know, I'm recruiting and I'm talking about. So Dr. Agbemenu will give us a brief about Kenya as well.
Thank you, Gloria. So while my parents are Ghanaian, I grew up in Kenya. So I speak one of the Kenyan languages. I speak Kiswahili. I understand a little bit of my Ghanaian language, Ewe, but I feel mostly Kenyan. But we thought that this was a very interesting map that was portrayed here. Gloria and I were talking, and I said to her, you know, this is a map, I believe, from National Geographic, where they are mapping out the different ethnic groups. And the way this map is, first of all, has Kenya divided by provinces. And that's not a way we talk about Kenya anymore. Provinces don't exist. We've moved on to districts, municipalities. We don't have provinces. So just thinking about that, you know, this map is dated, first of all. And then because I grew up in Kenya and I know about the different populations, I do know how to appeal to Kenyan potential participants in our studies. An interesting fact about Kenya, if you look at the map, you see central, and central is in red over there. And while this is a small region in Kenya, the population that lives in this region influence pretty much everything that happens in Kenya. They are a small group, but they are the majority in politics, in business, in many social settings. So again, you know, Gloria mentioned, who exactly are you recruiting when you recruit and you say you're recruiting Kenyans? We were also talking about the fact that despite the fact that Kenya is quite metropolitan, Nairobi is a very vibrant, fast, modern city. We do see some practices that we did not really anticipate finding in this population. One of them that comes to mind is female genital cutting. So I would think if you know anything about Kenya, you might not think to yourself, this is a practice that goes on. Maybe if you're more knowledgeable, you know that it's a practice that might happen in the northeastern regions, the eastern region, because that's close to, on the side, to our neighbors in Somalia who have those practices. But then again, it speaks to, do you know who you're recruiting when you talk about certain countries and the different ethnic groups and the different cultural contexts that you are wading into? So again, that's just one of the challenges with recruitment. I'll let Gloria continue.
Yeah. The next challenge we deal with is fear of stigma. And this is one that, you know, is really challenging. And so from my experiences, we found out that participants usually fear that the findings will be used to stigmatize them further, or that the findings may not have any tangible benefits to their population. So for instance, some participants reported that if the research revealed high rates of infectious diseases, those findings will be used to further stigmatize African immigrants. And we found that especially during the Ebola era, where people would stigmatize Africans and say, oh, you know, you have Ebola, or, you know, your country is ravaged by Ebola. And so this picture here gives us an example where there was a social media campaign against stigma and discrimination, where it says, I'm an African, not a virus. And so we see this where people are very hesitant. And I see this a lot in my research because I look at HIV, a disease that is highly stigmatized, that people are very concerned that what are you reporting? And they would say it like I told Dr. Agbemenu that Ghanaians sometimes use humor to deflect, but then they are being serious with what they are saying. They will ask you, are you people going to say we don't know anything about HIV? Are you people going to write about us as if, you know, we are from the bush somewhere? And I've had people confront me about and say that your studies say that we don't know about HIV, but that is not true. Which people did you interview? And that is why it's very important that when we write about our research, and that is one of the things I am, you know, trying so hard to change, that if I'm conducting research among Ghanaian immigrants, I would not write and say African immigrants, because I do not know what is happening in East Africa and what is happening in West Africa. Ghana and Nigeria are very different in terms of culture, in terms of weight, in terms of access to healthcare. And so when I write my paper and I say African immigrants, I am not doing Africa or other, you know, groups of people any justice with my findings. I want us to now talk a bit about the lessons learned as we do our research, some of the lessons that we've learned. And the first one is build relationships and rapport. This is very important. Building relationships are so crucial. And it's just not just a relationship for the duration of the project, but long-term sustainable relationships. Even before you start your project, even before you conceptualize your project, you want to go in there. And one of the key things is that you want to meet people, but you want to listen. You are not going in there to tell people, oh, I think this will be great, and I think you should do this. You are going to listen to people. You are going to listen to what they care about and what they are interested in. You would attend events that are important. So the number of events like church service, naming ceremonies, these are things that are part of people's cultures. And so if you want to be accepted, if you want people to trust you, you want to be authentic to people, you would be part of these things. Because for most people, if you are not part of these things, that means you are still not a part of them. They will still see you as an outsider. You need to be accepted, and you will be accepted by the people when you go there and people are offering you food in their homes, not just water. When people begin to give you food when you come to their homes, that means that there is, because food forms a huge part of the culture. So when you go and people just give you water and say, oh, hello, hi, and being really polite with you and not having conversations, that means that, yeah, you are still just an outsider to them. And so you have to consistently do these things. These relationships must be very authentic. And then you build your program around that. So remember, people will talk to you when they trust you. And do not overpromise. Don't overpromise, I'm going to do this, or when I get this survey, this is going to change, this data is going to change this. It's okay to tell people, well, I don't know if anything, but if anything at all, I do know that we may be able to use this. We will build upon it, but do not go and overpromise. Just know the limits of what you can do and cannot do. When I was doing my research on PrEP and HIV, people kept asking, so what's next? And I explained to people, I'm in a PhD program, so I am going to publish this data. People are going to read. One of the things I can do is I will send you information about PrEP so that you know about PrEP so that you can share it with your friends. So just know the limits to that. The next thing is gender concordance and cultural competence. Very important. Now, within some cultures, and sometimes you'll be surprised that people, female, they would prefer you female to female, and sometimes they would prefer to have a man in the room. You would have to, talk to them. And I found it was funny when I was doing my interviews with HIV, when I was talking with the men, sometimes they would tell me, you're not a man, so you won't understand. And I'm like, oh, no problem, just tell me, I'll find a man to explain. But that's, just the recognition that I was a female talking to a man about HIV and sexual practices. There was just a limit to what they felt they could tell me in that sense. Cultural competence is important. And I think cultural competence cuts across all of the things that we will discuss today in terms of, the nonverbal cues, the verbal cues when you are talking to people, just understanding that, certain things are like your body language. When you're talking to most people, Ghanaians don't use the left hand. And so when you're talking to a Ghanaian and your left hand, you use it unintentionally. Whilst the person may not draw your attention to you, the person will make a mental note of it. That this person used the left hand to point something. This person used the left hand to touch something. This person gave me something with the left hand. And so even without that realization that, you've done anything, they've just made a mental note that this person does not respect me. So it's very, very important.
Gloria, I want to just chime in for a minute and just echo pretty much everything you've said, but I want to give some examples, some experiences from the work we've done. Just thinking about building relationships, and like Gloria said, you really have to be embedded in the community. One of our studies, the HIV attitudes, we were recruiting 100 women. It took 1 year to recruit the 100 women. And some of you here might have heard me say this before, but it was definitely a labor of love where we went out to all these different community events. I used to go to, there was one time I went to the Taste of Diversity Fair, and I saw other organizations and they had tables and they had surveys or whatever they were doing, flyers, and people would pass by and they just hand them to people. And, a part of me thought that, oh, if I try this, it will work. it did not work. I got to meet lots of people. We had good discussion, but it did not work for filling out a survey because we needed that relationship. We needed that rapport. It typically took us about 4 visits to get any surveys filled out for that study. We had a population who were, I would say, who are not aware of research. So we spent a lot of time informing them, educating them on the process of research, that this is information for the common good. This is information that if you provide, nothing bad will happen to you. This is information where we are not asking for any personal identifiers. That's one of our big things with our studies. We don't ask for personal identifiers, no names. We collect data in aggregate. So that's rapport. Oh, and one other story I have. There was one time I attended a Somali Bantu wedding, a reception. So they said to me, oh, it's a wedding reception and it's going to go on from around 9 at night until past midnight. I was really excited. I thought to myself, this is a reception. What sort of tasty food are we going to eat? I get to the reception and there was no food. There was no food. They passed around bottles of water. And I asked my one of my friends quietly, I said, what's going on? How come there's no food? It's a wedding reception. And they said, oh, no, we don't do that. You eat at home, we ate already. This is a celebration. We've come to dance and to just enjoy our time. We ate already. And that was very different. I have never attended an African wedding reception with no food. We usually have plenty of food, but that was interesting too, noting that I'm from one African culture and how things are done in other cultures. In regards to gender concordance, again, just echoing what Gloria said, I typically, or for the most part, have done my research with women, and it is because of the gender concordance issue. I talk about contraceptive use, family planning. This is not an issue that is restricted to one gender. However, I do know that the dynamic of talking to men about family planning is totally different. You might be glad to know that in this, we have a study going on now, and for the first time in 5+ years, I am talking to men about family planning. We have an advisory group of men, and I did ask them when we started out, I said, is it okay for me to be in the room? I should also mention that I do have a man who coordinates that group. So I was there in addition to the man. And Gloria, it was very interesting being in the room with the men talking about family planning. My colleague, Dr. Christopher St. Ville at the School of Social Work, is a very candid speaker, and the men were very open and honest with him. And I did feel like that is a very different dynamic to this conversation. That conversation would not have happened if he were not in the room, if we did not have a room full of men. So just highlighting the importance of that gender concordance and being aware of that, and hopefully finding ways to maybe skirt around the issue. Gloria, continue.
Yeah. Next is flexibility, being flexible. And that was one of the things that, you do know that there has to be flexibility, but it's also different when it's actually happening in the field, that people, you have to be flexible with timing. And so sometimes you'd say, oh, we are going to start this at 10. Well, people will come in when they want to come in. So you have to, be flexible with your time, schedule it such that you wouldn't have to worry. During my interviews with participants, I would schedule an interview for 2 hours, and it would go past that because first people want to talk about, they want to know more about you. They want to ask you questions before you start the interview. And then also in the middle of the interview, people will tell you, oh, please hold on, I need to do this. So you would have to hold on for minutes while people went about doing their, household activities, duties, and then we'll come back. Or people will say, oh, I have a call coming from home, I need to take it. And so just being flexible between, and I also noticed that, weekdays, weekends, like late in the evenings, I was having interviews like around 11 p.m. just because that is when, participants are like, I just got off work, I can talk to you now. And so just being really flexible with your time and not be saying, okay, I'll conduct interviews Monday to Friday, 9 to 5, or this is when best works for me in like that way. The other thing is very subtle visual nonverbal cues. This is very important. For me, I was doing, phone calls on WhatsApp but I'm still being able to pick up nonverbal cues, such as when I would ask a participant a question and they will pause and they will sigh, or I'll ask a question and then they will giggle, or I'll ask a question and then they would give me an answer and then they will laugh after the answer. And so sometimes when that happens, I'm like, yeah, you don't worry, just go ahead and tell me what you want to say, because I could pick up on it that they gave me an answer that they think I want to know versus what they really want to say. Consistently in the interviews, I had to do a lot of and these are just nonverbal. They, depending on how it is stressed, the participants know whether to continue to elaborate, or they would be saying something and I want them to elaborate. So instead of saying continue, I'll just use that nonverbal cue of like to keep them moving on. And so you would have to be able to pick up on it. Sometimes if you're doing in-person interviews or even on Zoom, sometimes you would notice that little facial reactions, they are just outbursts that people would have to questions. And I had that when I would ask people about, oh, what do you think Ghanaians would think about, a person who uses PrEP? And almost instantaneously, everybody would be like, oh my God, like the shock, the horror that they would express. And those reactions are very visceral. And so being able to see that and capture that even over the phone, right, it's so important. So being able to pick up people's emotions over the phone in person is so important because it gives context to the work that you're doing, to the research that you're doing. The next important thing is language. Local dialects matter. Yes, sometimes you will tell people, yes, we are conducting this interview in English. The survey is in English, but sometimes it's important that whoever is giving the survey is at least familiar with one or two languages of the population. Key being that one, there are times where the concept will not translate in how you have written it in English, and you would need to break it down in a language that they are familiar with. Or sometimes the way people wish to express themselves, English words do not be able to convey that feeling. And so people would, and I found that in my interviews, people will pause and say, do you speak any of the Ghanaian local languages? And I said, you go ahead. If I don't understand, I'll find someone to translate. And they would express themselves the way they want to. And so even though I had written in my IRB, I was going to conduct interviews in English, participants wanted to express themselves in the language they feel comfortable with. Some would speak Twi, Ga, other languages, which meant that I just had to find people to translate and make sure that they're translating verbatim for me to get what they wanted to say. And so this is so important. If you can, like I said, always have someone on the team who understands the language. It's so important. The increased reach and the power of networks. This is so important for the work that we do, because I had mentioned earlier in terms of recruitment, that word of mouth is powerful. That is much more powerful because it relies on the trust that exists between a community. And so when people, and it's a community that thrives on recommendation. If someone tells the other person, this place, don't step there, nobody will step there. It's based on, yes, the experience of one person, but everybody believes if you treated them like that, you treat me like that. And so with research, once you have people pushing and say, okay, we've established that network, people will push your work. If you are using a method of recruiting that people are familiar with, it makes it easier. So then the language does not become hard to reach populations, right? Because it's the method that we are using that makes them hard to reach. If you are leveraging methods that they are familiar with, they do not become hard to reach populations. One of the key things also is working with the IRBs for increased understanding of the population. And that is one of the things for me in my research, I give props to UB's IRB for that. They would ask questions, they would listen as you try to explain to them. The number of times you've had to simplify consent forms, and they will ask questions, how do we go about this? Because we have to make sure that the consent forms are simplified, that people read it and they understand. They get the point, is straight to the point, they understand it. So working with IRBs to really understand the population and why things are being done in a particular way. For instance, when I was doing my research, I asked people, I had to call people on WhatsApp call. And so the IRB asked me, the person who spoke with me was, if you're calling them on WhatsApp, why don't you call them on regular phones? And I was like, no, participants have told me, people within the community have told me that there's a difference between WhatsApp call and regular calls. The difference is that WhatsApp is end-to-end user encryption, privacy. People trust WhatsApp. They've built that. And so if I would say, oh, I'm taking your number and I'm calling you, it's not the same for them. And so whilst it may look like, yes, it's a phone call, at the end of the day, it's not just a phone call. It is what people think about WhatsApp that they are leveraging in that sense. And one of the things is cultural humility, the last but not the least. Very, very important. Adopting a lens of cultural humility, demonstrating a desire to learn more about the people, more about what is culturally appropriate. This is one of the things that has actually enhanced our success in recruiting immigrants and refugees for our studies. Very, very key, very, very important. And it's not a place you arrive at. I think that usually people see it as, oh, I'm culturally humble. It's not a place you arrive at. It's a learning process. You are always learning something new about a people, about a person. So approaching every research with, I need to know more. I need to know what is appropriate and how to go about this. I would want to summarize this particular one with observations from my research, where one of the observations I had mentioned that the interview started with after the participant had interviewed the interviewer about the background. They wanted to know who I was, where I come from in Ghana, which ethnic group I belong to, when did I come to the US, what am I doing, and why am I focusing on prep? And throughout the interview, I noticed that they were so concerned about not giving the right answer. And I always had to assure them that this is not about good or bad, right or wrong. The correct answer is just your experience. And so throughout that, they would, pause and, to go ask for you pick a call, do other things, or just ask for clarifications. And they were so concerned that they were like, please don't transcribe that into, your interview or anything. Like, please don't put that in your papers that you published, because sometimes they will ask for clarification in the local language. And they were so concerned about how this will look. Like I said, how we publish our results. And after the interview had ended, they wanted to stay on to ask me about next steps. They wanted to keep my number and said, if anything was coming from me, they want to take part in it and they want to share it with other people. This other one also captures that, the use of that nonverbal cues to encourage the participant to keep talking. And so it's more or less a conversation and not a question and answer section. And okay, the use of the word okay or continue is not one that they are used to. So when someone says something and I say okay, it ends the conversation. It means I understand what you're saying. So it would end the conversation. So continuously I had to keep doing to let the person know that I am listening, keep talking. So there were just those occasional pauses where they would process their thoughts. Also, there were just that occasional jokes of, are you being paid by the people who do this medication? And I say jokes, but these were not jokes because they kept asking throughout all the interviews that I was doing. People were like, how much are you being given? Are they forcing you to come convince us to take this medication? And after explaining over and over to people that, no, this is just for my PhD, people were now happy. They're like, oh, it's important to have one of us do this research. And the interview took longer than the estimated 1 hour, because I was going for between 2 hours to 3 hours. But then that is because a huge chunk of the part were people trying to know me before they started talking to me. And they will let me know who shared even the survey with them. And they will tell me, oh, it's because this person shared it, so I wanted to take it. So that's the end of our presentation. Thank you so much. We will take any questions and comments.
Oh, I'm not on. Thank you so much to both of you. This was so interesting and just illuminating. I want to open the questions to our audience. There is several people who have typed in questions, but definitely keep them coming. one observation that I will just make, and this is when I was in graduate school, I took a course on qualitative research methods. And this speaks to what you were just saying, being interviewed by your interviewees. You know, we talked about building rapport, and, you know, the methods that we were taught to build rapport was, oh, you know, ask people about their day and how things are going. And there was nothing about you giving anything of yourself. So what you're saying just, you know, is kind of revolutionary to me. I mean, I don't really do qualitative research, so I guess I should clarify that to begin with. But what little I knew, you know, was based on you kind of stay, I don't know, impartial or hidden, and yet that's not what your participants want from you. You clearly had participants who wanted to know who you were and what your intentions were, and I mean, it makes perfect sense now that you've said it. So thank you for sharing that. So that's just a little comment, and we don't have to belabor that. But that struck me. So I will go ahead and start looking at what questions people had. So one was an earlier question coming from Seth, and this relates back to the research itself. And he's asking, while there are risks to home births, can an intervention be made where midwives are allowed to go into the home? This would allow cultural practices to be implemented while also allowing a midwife to get a woman to the hospital before issues come up. And this would be in contrast made to the observation from the research that Kafuli was talking about. So I wonder if either Kafuli or Gloria would like to take this first question.
Oh, thank you. I'll take this question. So very interesting, very good question. I'm trying to think about the different levels of this question. So in regards to midwives going into the home, I would say that to some extent, there's an element of acculturation such that once African immigrants, refugees come here, they don't continue to embrace that practice of having midwives come into the home. US culture has told us that you go to a hospital to have your child, and that's what is happening. We're not seeing very many home births. That said, for example, with our partners at Jericho Road Community Health Center, they have a program, Priscilla Project, where women are linked with a doula who is also a community health worker. And this is a member of their community. So a doula is sort of a lay person who advocates for the mother in the healthcare setting. So women who are going to deliver are linked with this, with a doula, and they're able to go to the hospital with the doula and have the doula advocate for them and support them in the birth process. But in terms of going into the homes, unfortunately, that is not happening anymore.
Thank you. I will go on to the next question from Evans. How did you manage to convince those worried about their identity being exposed to participate in your research? And I think this, Gloria, why don't we start with you, and then Kafuli, maybe you can add your perspectives as well.
Yeah. So one of the things Dr. Agbemenu had mentioned was how sometimes you have to explain the whole research process to people that you want to take part in. You have to explain the process, and then also explain to people that when we are reporting, we are not reporting just your information, we are reporting aggregates, right? We are putting everything together. So nobody can trace anything back to you, and nobody can say, oh, it's from this particular person. For my interviews, for instance, for those who were, strongly against that, even after I had explained it, it was okay. They didn't provide me with any demographic information. And so that was fine because, they were not comfortable with it. And so for those who provided, I used that information, but then made sure to, add that, people were not comfortable and explained, provided the context, right? So it's not just people were not, comfortable just providing the information, but explaining the context in which why, we are seeing this happen. That, sometimes people provide information that can be used against them. And so like that history. So that is how I make sure to tell people, explain to them that it's not just about you, but it's just the aggregate, the group. Yeah.
Yeah, absolutely. I would just add to that by saying it's a matter of building trust. Once you build trust with a community, you've been introduced, recommended by someone else, they're more likely to trust you and to participate in research. I do remember one incident, and this is, it really stuck out to me, where I was giving a participant a gift card. And she was so scared, and she said, absolutely not. I am not taking anything from you because I am scared that it could be tracked. And just reflecting on that experience that, this is someone who came from a war-torn country who believes that even with this gift card that has, no identifiers, nothing attached to it, a TOPS gift card, that she could still be tracked. And the fear was so great. She said, I will be involved in this study, but do not give me anything. And I think that's also happened on Gloria's end, where people are saying, no, don't give me anything. It's okay.
Yep. They said it wasn't worth the money I was giving to them for them to give me their, information. The money wasn't worth enough. Like it's not much for them to risk it as well. Yeah.
Thank you for sharing that. There is a comment from Kate, who I know has left she's no longer with us, but she says, I have found that recruiting from English classes for refugees effective too, especially since it is a requirement as part of refugee relocation. I wonder if either one of you has perspectives on this type of recruitment?
Yeah, it's unfortunate that Kate is in here because I would like to know maybe what was she recruiting for. In my experience, that has not been effective. It to some extent could be, a population willing to please. And she mentioned they're in a class, so they might feel obligated to do this. But in my experience, it hasn't been effective, no.
Thank you. Seth, if you don't mind, I will go on to another question or comment. So I was wondering, there is another one from Lavina. Do you think it is appropriate for those who are not African to try to make connections at places such as churches or African markets?
Yes. If you've ever gone to an African church, they will give you one of the best welcomes you've ever had, and even the African markets, right? So you going to the African market, having conversations, like I said, people just go and then hang out there, right? To meet people, other people, and talk. And so when you go in there, you talk to people, you're interested, people will welcome you. When you go to church, people will try to, the first they would like say, is there anyone here who's visiting us for the first time? Or, they'll come, stand up, let's give the person a welcome. Everybody comes to welcome you. So it is one of those things that, you would be very much welcome. And so, yes, it's always appropriate to try to make connections at those places. Yeah.
There is another question from Timothy. Did you use incentives for your interviews? And I think you alluded to this as payment. How did you decide on those incentives, for example, amount? And if you didn't use incentives, how did you decide not to, or why did you decide not to? So I think there may be probably different answers for different studies. So Gloria, would you answer that first, and then Kafuli, if we could go to you.
Okay, sure. So for my first interviews, there was no payment. So people were spending close to 3 hours, 2 hours, 1 hour with me for no money, for which I'm so grateful for. But that is also because people were happy, to know that this research is being conducted, this information is going to be put out there. And then also because I am a graduate student and I don't have money at the time. And then my second study, which was a survey, actually I decided I was going to do the gift cards, the Amazon gift cards, because I had asked around and people are like, please do Amazon, because I was recruiting across the US. So people are like, yeah, Amazon is best, just do Amazon. Based on, I had applied for McDiamond funds. McDiamond funds says if you have, between 1 hour, it's at $10. So that helped me, decide that I was going to pay $10 using Amazon e-gift cards. But then, like I said, my participants were like, yeah, it's not necessary. It's okay. We'll fill the survey. You don't need to give us money. You're a grad student, and so that also helped me recruit more than I had intended, because I had intended to recruit 150. I ended up recruiting close to 600. Yeah, just because, people were declining it and said, no, it's fine, just keep, I'll keep sharing it and stuff like that. So that's how I determined, how much I was going to pay and how I paid them. Yeah.
On my end, I always compensate for my studies. I think it is important that I appreciate their time. I respect their time. And if we think about, again, US society, how do people respect your time, or how do people show that they respect the knowledge that you provided? There's financial compensation. So I always compensate my participants. In regards to amount, it's usually driven by budget for the most part, but I try to compensate as much as possible. I do work with a translator, interpreter, and I do pay her going rate, market rate. Definitely don't try to undercut anyone. But then there are nuances to it, because sometimes we have, I don't know if my internet is slowing down here, but sometimes our participants say to us, this is not enough money to be involved in this study. Mm-hmm. And we realize that, but we also know that a lot of our participants are working very low income jobs, taxi drivers, housekeeping, a lot of housekeeping, factory work, such that I want to say to them, I respect your knowledge, I respect your time. I am willing to compensate you for this, a job that is not as tiresome, as burdensome, as heavy as the work that you typically do. Because you deserve it, Mm-hmm. So a lot of my budget goes to compensation. And when I have meetings in person, I always have food, I always have something to drink, and it really increases the budget, and it makes life a little bit more complicated, but it is necessary. Compensate people for their knowledge.
Thank you. Let's do one more question. And this one, again, comes from Evans. And the question, I think, is directed to Gloria, which is, to what extent did your background as a Ghanaian affect your data gathering and analysis of findings? And perhaps this comes on the heels of a comment that was made earlier, where situating and contextualizing research findings is very key, and that comment is also from Evans. So I'm wondering, Gloria, if you could respond to this.
Yeah, I think it's very important that when my identity as a Ghanaian actually does inform my research, as an African does inform my research. And with this particular research, one, like I said, sometimes being in academia, you are Ghanaian, but then when you're in academia, sometimes how you structure your questions. So when I did the pilot, I had people say, yeah, you're using too much jargons. We don't understand this. Explain. And then when I was using words like, was it medication? People were like, just say medicine or say drugs. Like, that is what people understand. What is medication, right? When I was explaining what PrEP was. And so being able to have people understand. Now with data gathering, so what was happening was, when I sent out the link, usually people would take that link and add their own spin to it and say, oh, hey, a friend of mine is recruiting, kindly help out. And so usually, most of the time, people would only know that this person is Ghanaian by my name after they've opened it to try to put the information in there. And that is why we spent a lot of time doing the interview before I interviewed them, right? And I feel like, yes, my background as a Ghanaian actually helped a lot with data gathering. First, it helped, pushing it out, helping people be interested to take part in it. And also was very specific, Ghanaian immigrants. Usually our research is not like that. Our research is African immigrants or Africans, right? So people are curious, who is this person who is like trying to hone in on just Ghanaian immigrants? There's that. Then there's also, just even the interviews, being able to pick on, things that are just very Ghanaian in that sense. Because if someone else had conducted the interview, without that level of cultural competence, they would have missed a lot of cues that were happening in the interview. With data analysis, so I analyzed the data, so all the data was de-identified. And I had an undergrad research assistant at the time, and I gave her the data without telling her. She was reading the transcripts and came back and she said, these are Ghanaians, aren't they? And I was like, why? She was like, look at the responses. Look at the way they phrase things. These are Ghanaians. And I'm like, you can't be too sure. And she's like, no, she's 100% sure these are Ghanaians. And so it has, even with the analysis of it. And so coding with others helped, right? Because being Ghanaian means that things I understand. And so I would say, this is what they mean. But having someone else who is also not from that background look at it, and then having another person who's also from that background look at it and say, no, this is exactly what they were saying. And so you are not being biased. So it's very important. And that's why in qualitative, we have, the inter-rater reliability, just that iterative process of, making sure that there is agreement is very important. So yes, definitely my identity as a Ghanaian helped with, data gathering and also the analysis.
Thank you, Gloria. Kafuli, I hope I'm not putting you too much on the spot, but I wonder if you could give your perspective on the same question. I mean, obviously, it's not you as a Ghanaian and doing research among Ghanaians, but I wonder if you can give your perspective, on this topic in general.
Sure. I think, unfortunately, I have to echo what Gloria is saying. I don't have too much more to add to that. That, your identity as an African immigrant is important to this process. I am on, I would say, like the other side of the continent where most of East Africa speaks Kiswahili. We speak it in different ways. I wouldn't say they're dialects per se, but we use some words in different ways. So it is really important to have someone who is part of the culture, again, be able to understand all these different aspects. Or my participants would be saying to me, oh, you remember the way we do such and such a thing back home? And it's something that I relate to, something that I am aware of. Maybe there was a campaign that happened all over East Africa, and I am able to relate to that historical event. So it is very important. I don't know how much more my studies would cost if I did not speak Kiswahili. I'm going into rooms where a lot of my participants don't speak English, or I was thinking about this the other day. I asked Gloria to take notes on a meeting I had with the women, and we ended up speaking no English. So that wouldn't have been very good if Gloria was there. It would not have helped. It was very useful to be able to speak the language, to understand the perspective of the women, to sympathize with how life has changed in this country, or maybe not sympathize per se, but to understand, to appreciate, the nuanced aspects to it that sometimes are hard to put into words, but there's a lot that goes into it. And I consider myself an instrument in the research that I do, and I do think it is important to have this cultural background to be able to get the work done.
All right, thank you both for sharing your research, for sharing your perspectives, and also answering our questions and talking to us, just sort of getting more deeper into these issues. If there are no other questions, I will now. Selena.
I have a question, if I may, just orally ask it. This was a fantastic presentation. Thank you, both of you. Really enjoyed it. And it was very timely because I have been wrestling with a recent research debacle, if I might call it that, that has raised some questions of ethics. And I would love to get your guidance, Dr. Agbemenu, as well as soon to be Dr. Frimpong. So there was a situation where a medical anthropologist used ethnographic methods to study mental health trauma in a global South setting where the researcher was not from that region. So no similar language, no identity, shared identity that you all were talking about. What got more complicated is that she had a next of kin who was part of the institution perpetrating some mental trauma in that region. This is kind of a war situation. So she never revealed her positionality or identity to the respondents. And then the work was published. And this has just been revealed in the last couple of weeks. So there's a lot of dialogue in Global South ethnographers and anthropologists about whether this is appropriate or not. And there are pros and cons. Some are saying, well, she didn't have to reveal that because it didn't influence her work. I'm curious, not having revealed the place, the person, etc. What would be some concerns that would come to your mind in that situation? Why or why not? Just looking for your guidance on that tension about researchers' own identity when it is in conflict with those that they are studying.
Great question. I'm still mulling it over, trying to understand what happened, but I do wonder if, first of all, if this researcher worked with a team from the country. I'm wondering if they considered the cultural context. I'm concerned that they, as you know, the researcher as an instrument was not acting appropriately. And I wonder if they did not consider having other people do this work instead. It is definitely lots of ethical quandaries there. Do you have any additional information? What happened next? Why did it happen? Oh, you're on mute.
Sorry, it is literally unfolding as we speak. It's actually in a research setting where I also work, but I have been just observing because it's so complicated. She's an anthropologist, so she uses ethnographic methods, and I don't believe she worked with a team per se, but I'm sure she had translators because she does not have the local language. But turns out, there's this direct conflict of interest. But your comment that a researcher is, an instrument, if you will, got me thinking about that. And I was just curious what you thought.
Gloria, I don't know if you want to chime in.
I mean, yeah, I was listening and I was like, when she mentioned her next of kin, that not being declared, I was like, oh, okay. Because then when people find out everything you did, it's like, oh, so you were just using us. What are you going to use the information for? And it's not just about you. What then it does is researchers after you may never get that chance again. That is what it is. And for ethnography, one of the premise of ethnographic research is when you are very embedded in the community. So being embedded in the community, you don't get to hold back that information and say it doesn't affect. It actually affects the work that you do, because that information will be published. That information will be in public domain. It would be used. And so it's, when we say ethnography, I'm like, yeah. That, and especially as an anthropologist, because you stay with them, you live with them, you become a part of them. And so the numerous conversations you would have with people, it did not even once come up. Oh, and sometimes, you would be able to tell people, and people will even give you solutions. You will talk through, okay, so how do we go about this? Now that you people know that I have someone in there, how do we do this? And so for the particular methods that they use, like Dr. Agbemenu said, as an instrument, yes. They are just issues, ethical issues that were breached.
Yeah, I was reflecting that we have IRB as standards, but the questions that Gloria, you were raising and Kafuli was raising, I don't think they get captured in IRB. I think you are demanding and talking about a standard of care for the communities in which we conduct research that I don't see it covered in IRB. And I think it was the case in this researcher's condition as well. She or he may well have had IRB, but the care extended to the people, I see it missing. So anyway, thank you for responding to that. Back to you, Kasha.
Right, thank you. So we will now end. Thank you to the attendees who joined us. Thank you for your questions and the discussion. Thank you again to Kafuli Agbemenu and Gloria Aidoo-Frimpong for their excellent talk and discussion. And I invite you all to return in a month for our next seminar on October 21st. Take care and see you later.